Have you ever wondered how a tiny pill knows exactly where to go in your body to relieve a headache? Or how a simple injection can fight off a serious infection? The answer lies in the fascinating world of pharmacology. If you're a healthcare student, whether in PharmD, MBBS, nursing, or any allied health field, understanding pharmacology is absolutely crucial for patient safety and effective treatment. So let's dive right in and demystify this essential subject together. So, what exactly is pharmacology? In simple terms, pharmacology is the science of drugs and how they interact with living systems. It explores everything about a drug, from its origin to its effects on the body and how the body handles it. The scope is vast, covering drug discovery, development, and therapeutic use. It's the backbone of modern medicine. Pharmacology is broadly divided into two main branches: pharmacodynamics and pharmacokinetics. Think of it like this. Pharmacodynamics is what the drug does to the body. It's about the mechanism of action, how a drug produces its effect. Does it block a receptor? Does it activate an enzyme? This branch helps us understand a drug's power and effectiveness. On the other hand, pharmacokinetics is what the body does to the drug. This involves four key processes, often remembered by the acronym ADME: absorption, distribution, metabolism, and excretion. Absorption is how the drug gets into your bloodstream. Distribution is how it travels to different parts of the body. Metabolism is how the body chemically changes the drug, often to deactivate it. And finally, excretion is how the body gets rid of the drug, usually through urine or feces. Understanding pharmacokinetics is vital for figuring out the right dose and frequency. Beyond these two core branches, we also have others like clinical pharmacology, which focuses on the application of pharmacological principles to patients. It's where lab science meets the real world of clinical practice. Then there's toxicology, the study of the adverse effects of chemicals, including drugs, on living organisms. It's all about safety and understanding potential harm. Now, where do all these drugs come from? The sources are incredibly diverse. Many originate from plants, like morphine from the poppy or digoxin from the foxglove plant. Others come from animal sources, such as insulin, which was historically derived from pigs or cows. We also get drugs from minerals, like iron supplements for anemia. But today, a huge number of drugs are created through chemical synthesis in labs. And with advancements in biotechnology, we can now engineer complex drugs like monoclonal antibodies to target specific diseases with incredible precision. So, why is all this so important? A solid grasp of pharmacology allows healthcare professionals to use drugs safely and effectively. It helps in selecting the right drug for the right patient, determining the correct dose, and avoiding dangerous drug interactions or adverse effects. It's the key to maximizing therapeutic benefits while minimizing risks. And a quick note on a common point of confusion: what is the difference between a drug and a medicine? A drug is the active chemical substance that produces a biological effect. A medicine, however, is the formulated preparation of that drug, like a tablet, syrup, or injection, that is ready for administration to a patient. So, paracetamol is the drug, while the tablet you swallow is the medicine. Alright, let's do a quick recap. We've defined pharmacology as the science of drugs. We covered its main branches: pharmacodynamics, what the drug does to the body, and pharmacokinetics, what the body does to the drug. We also looked at the diverse sources of drugs, from plants to biotechnology, and emphasized why pharmacology is fundamental for safe and effective patient care. I hope this introduction has made pharmacology a little less intimidating and a lot more interesting. If you found this helpful, please give this video a thumbs up, subscribe to our channel, and let us know in the comments what pharmacology basics you'd like us to cover next. Thanks for watching.